Hi, this is Shelley Kraft coming to you live on SNNLive. We're at the AdvaMed 2011 Conference, also known as the MedTech Conference, and we're here in the nation's capital, Washington, D.C. I have Bill Gregory, PhD, Dr. Bill Gregory of NovaScan LLC, a private company, and welcome to SNNLive.
Well, thank you.
It's good to have you. So for our viewers, tell us about NovaScan.
Okay, NovaScan is a company that makes a device that's electrically based to find cancer. And our first product is a device used by the surgeon to find residual cancer, the little bit of cancer that's left over that you can't see by eye when you're doing breast surgery.
So tell me, how does it work?
Well, it uses the electrical properties of the tissues, and in particular, the cell membranes store electrical charge, and this charge drains through the cell, through the resistance of the cell. The product of the resistance times that electrical capacitance is a time constant. We measure that time constant, and it's 100 times bigger. 100 times smaller time constant for cancer than it is for regular tissue.
So did you develop this?
Yes, I'm one of the two inventors. My son, like your son, is involved in our business, and he and I are the inventors on the patents.
When is this coming to market?
Okay, it looks like we will be in the European market and perhaps Canada, etc., in about 2013. As you know, it's not an easy trick to get the FDA approval. We hope to be starting around the latter part of 2015 in the United States.
Well, it's non-invasive, so, that helps a little bit.
It helps a little bit, but it's probably going to be what they call a PMA, a pre-market approval, rather than what they call a 510K.
What do you call it?
We call it fast path because it's a fast pathology.
So what is it? What kind of a device is it? Is it a handheld?
Yeah, it's a little probe type thing, and the surgeon can scan around in the wound, and if she or he finds a beep, then they'll go in and they'll take a little more tissue out at that point.
Aha. So this is done during surgery.
Yeah, the point is right now you can't do that. So what happens is a patient is on the table, they get as much cancer as they can, they close up, 2 days later they get the slides back and they say, oh my gosh, we have more cancer there. So 20 to 40% of the time, sometimes more, there are repeats. A repeat is not only expensive, but it raises the risk.
What's your background?
I'm a PhD in physics, but my undergraduate degree was a dual degree in physics and philosophy, and I won the medal in philosophy. I have a lot of fun with that. Excuse me.
So where are you located?
Milwaukee, Wisconsin, on the Aurora Sinai Medical Center.
So, what is your website?
It's NovaScanLLC.com, www.NovaScanLLC.com.
What do you think, in your wild imagination, because you probably have a wild imagination, what is the size of this market?
It's probably, considering not just breast cancer, but there's at least 5 cancers, it's at least $1 billion a year, perhaps bigger.
I just find it amazing, so have you done any clinicals yet?
Yes, we have done 2, they call IRB, or Institutional Review Board approved clinicals. One of them we had about 300 patients. We have about a 94% sensitivity and 83% specificity through those. We've also done another gadget that's essentially an electrical mammogram. That was a smaller study, but the results, and I hate to even say this, were 100% perfect.
What does the medical community think of this? Are they welcoming it?
We spent 18 months going around asking anybody we could from, hey doc, could you tell me about this? And it's not always easy because they're busy folks, but I'll put it this way. I think one of the surgeons was about ready to kill me if I didn't get this device out. She really wanted it because she's one of the ones who helped us get the research started in the first place.
So interesting. Website one more time.
NovaScanLLC.com. That's spelled NovaScan LLC.com.
viewers, doctors, patients, you want more information, go to the website. I'm sure Dr. Gregory will take your call. You seem like a guy that takes a lot of calls. You know what I mean?
I forgot to turn my cell phone off.
So thanks for coming to SNNLive.
Thank you. Bye-bye.